Good afternoon, everyone. My name is Kimara Ellefson, and I have the privilege of serving as the National Director for Partnerships at the Kern National Network for Caring and Character in Medicine, or the KNN. Today, we kick off our new series, Human Flourishing 2030. Why 2030? Because throughout this series, we will explore what it will take over the next decade to achieve a healthier future where healthcare learners, practitioners, and patients are flourishing. And that means examining how characteristics of communities, organizations, and other settings affect the flourishing of those within the health ecosystem, as well as the factors that surround that ecosystem. In case it's your first time joining us, we'll start with some brief background on the KNN. In collaboration with 7 founding member schools and stakeholders across the healthcare ecosystem, the KNN is dedicated to advancing caring and character in medicine with the goal of promoting human flourishing. We believe that when clinical learning environments, care settings, and healthcare organizations support the well-being and purpose for learners and professionals, that then practitioners, patients, and families can truly thrive. Guiding these efforts is the KNN's integrated framework, which shows our hypothesis on how caring, character, and practical wisdom or wise reasoning are dynamically related and synergistic in promoting human flourishing. The tree shown here depicts the entire concept of flourishing as it suggests growth and change and organic development. Of course, flourishing is not static. It waxes, wanes, and evolves over time and over a lifetime. Yet much as a tree's strong trunk and branches allow thriving leaves, the interconnected concepts of caring, character, and practical wisdom support human flourishing and advance the profession of medicine. The visual also shows these concepts operate at many levels: individual, organizational, and societal. In the Human Flourishing 2030 series, we'll be going beyond individual flourishing, which we focused on in last year's series, to explore flourishing in healthcare from broader organizational and societal perspectives. We'll start the series today by exploring how flourishing creates possibilities for improving community health and wellness that go beyond direct patient care. The stories that you'll hear from Dell Medical School offer a powerful example of what can happen when everything from the physical environment to systems and curriculum are designed to encourage thriving. While the community at UT Austin is one example, the lessons from taking a human-centered design approach go far beyond Dell Med alone. It's important for all of us to consider how our environments, learning journeys, and understanding of others' needs can contribute to or detract from wellness at the community level. To dive into these issues today, I'm very excited to introduce our incredible panelists. First, we have the KNN's own Dr. Sue Cox, who was integral to starting Dell Medical School. Dr. Zack Timmons is a former Dell Med student and current emergency medicine resident who co-founded Good Apple to benefit his community. And our moderator this afternoon is Larry Speck, who is also part of the UT Austin community and designed Dell Medical School's health learning building. To make sure that you have the best possible experience today, please select Speaker View as shown here on the slide. Our panelists will be available after the main program to answer questions. But if questions arise for you during the discussion, please send them as soon as you think of them. You can send a chat directly to the Q&A, and we will add them to a running list for the end of the session. Finally, before we turn to our speakers to hear about their experiences, we'd like to take a moment to tap into our own experiences. So let's pause to consider, what is one word that describes flourishing in your community? If you would take a moment and just enter those words into the chat. I'm seeing things like resilience, connectedness, thriving, unity, creativity, joy, purpose, progress, energy, mutual support, growth, love, purpose, social connection, belonging, passion, balance, deliberate life. Imagine, imagine if our academic medical centers, if the health ecosystem, if the communities, if the environments that we were all a part of, if those were the words that we could describe those environments that we're creating and a part of: harmony, transforming, being stretched in wanted ways, compassion, love. Thank you. It's incredibly powerful, and hold those thoughts and ideas in your mind as you hear what our panelists have to share with us this afternoon. So without taking any more time away from our panelists, Larry, I'm going to pass it off to you.
Yeah, my name is Larry Speck, and what we're going to do at the beginning here is I'll give a little introduction of myself, and then I'm going to hand it over to Sue. She'll give a little introduction of herself. Same with Zack, and maybe at the end of that introduction, each of us sort of saying what we have to offer to the discussion today. So I'm an architect. I have been a faculty member in a School of Architecture for ever since I got out of graduate school. I'm a professor of architecture currently at University of Texas at Austin. I was dean of the School of Architecture here for 9 years. I'm a dyed-in-the-wool academic architect. But I also am very much a practicing architect. So I've had my own practice for all of my adult life. I've, for 20 years, had my own office, Lawrence W. Speck Associates. But since 1999, I've been a senior principal in a very large architectural firm called Page. We have offices in Washington, D.C., Denver, San Francisco, Houston, Dallas, Austin, Phoenix, Mexico City. And we do all kinds of buildings all over the world. And I make buildings. I love to make buildings. That's the thrill of being an architect. But those are my jobs. There also is maybe my life work, which I would describe my life work as being an advocate for architecture. I'm out there crusading for people to understand this phenomenal, interesting, influential discipline in a much more thorough way than they generally do. And I have taught at University of Texas, I've taught a class for about 30 years called Architecture and Society, where we have 500 students every semester. They're every major you can imagine. Architecture students are required to take it, but most of the students are from across the university. Very popular class, really about figuring out, how does this discipline influence my life? How can I use this discipline as a tool to enrich my life, to help me flourish? So that's a bit about me. And obviously, that latter mission is very much in keeping with the kind of discussion we're having today about how can my field, architecture, contribute to flourishing. So take it away, Sue.
Thank you, Larry. So my story is, I'm Sue Cox. I'm the prior executive vice dean of academics at Dell Med School, but I had the honor of being the planning dean for Dell Medical School. My background is I'm obstetrician, gynecologist, maternal fetal medicine specialist. So I take care of high-risk moms that have complications, and really got interested in education because of my love for teaching. And through that, moved up the education ladder at UT Southwestern, where I spent 25 years. I started as a clerkship director, so not getting to design anything new, taking over a clerkship that had been long entrenched in tradition, became the dean for professional education and the fellowship director for maternal fetal medicine, moved on into graduate medical education and the dean for the clinical years, and then the senior dean at UT Southwestern when I was asked to take on the role of the regional dean for education in Austin to oversee our residency programs. So I thought this was going to be a job that I got to move to Austin, live in a great town, not work very hard because I didn't have all that other responsibility. And then we have a state senator that wanted a medical school in Austin, Texas. And 2 weeks after I got in Austin, he said, I want a medical school in Austin, Texas, and you're going to help me. And the rest is history. So I had the opportunity of being the planning dean. And little did I know that being a planning dean meant you had to be on the building committee. But that's where I got to meet Larry and work with Larry. So, Zack, I'll turn it over to you.
Perfect. Thank you so much, Larry and Sue. I am a little bit earlier in my career, but I'm very honored to be part of this panel. And as we'll talk about later, a lot of my work has been directly influenced by both Sue and Larry, which we're excited to talk about today. But a little bit about myself, originally from a small town just outside of Waco. I went to school at Rice University in Houston, where I worked as an EMT. That was probably where I got my first love for medicine and taking care of people. Took a little bit of a detour and worked as a management consultant in healthcare, and really enjoyed that aspect of systems work within the healthcare system. And I think, that aspect of not only providing great medical care as an EMT, but also thinking about the larger community factors that impact health, the different social determinants of health, how buildings influence how we take care of people, was a big reason why I came to Del Med. So I was a Del Med student, just graduated last year. Had an incredible experience there where I was able to learn great medicine, but also take some risks and venture out into the community outside of the walls of the med school and create a company, Good Apple, which is an Austin-based produce delivery service addressing food insecurity. And I think, that work was really influenced by both the spaces at Del Med and the curriculum, which we'll talk more about. But it was a great example, I think, of how we as people involved in the health system can reach out to our community and have a big impact. So I'm currently completing my emergency medicine residency at McGovern Emergency Medicine at the University of Texas Houston Health Science Center. So I've been really enjoying that, but excited about the conversation today.
Excellent. That sounds great. What great colleagues to discuss this with. So I think in a broader sense, what we're talking about today is social determinants of health. And that was a phrase that I heard Zack just use. There's a wonderful article with that topic on his website for Good Apple. But it's really an important notion that our health is determined by our lifestyle, by the way we live. And maybe the two most fundamental things about how we live are food and shelter. And we think of those as just necessities, food and shelter. And in a very coarse way, we could say, yeah, you need food so you don't starve. You need shelter so you don't freeze to death. That's a really dumbed down way of looking at these fundamental needs. In a much more sophisticated way, we can think of these as these are the tools for flourishing. Our food and our shelter are fundamental areas in which we either flourish or we're deterred from self-actualization. So today we're going to be focusing on food and shelter. And I want to emphasize that our experience of both of these things is often subliminal. We're not consciously experiencing the environment around us, the physical environment. We're not sitting there saying, oh, this is affecting the way I feel or the way I think. But it is in a very profound way. And much the same way with food. Sometimes we're ingesting food and we're not really thinking of its, effect on our nutrition or its effect on our mood or its effect on our digestive system. All of these things are often kind of unconscious. So today we're going to, in a way, bring these things to the fore and talk about food and shelter, talk about food and the physical environment as tools for flourishing. And I think these occur at three different levels. Certainly at the level of personal flourishing, that our food is, it's certainly in its nutrition is important for our health, but our food is also very much a source of sensual pleasure. It can be delightful, it can be delicious. It also often is a source of joy or happiness, but it also, if you have food insecurity, can be a source of misery and pain. So we're going to look at food and its availability and its sourcing and all of those things as something that can enrich and make us flourish, or it can be a problem in our lives. At the level of a community, I think we often don't think of food as an industry, but it is a huge industry. It's a big part of our economy. How we do that, whether it's family farms or whether it's agribusiness, these are fundamental things about how we form ourselves as a community. And they impact very much our neighborhoods, our cities, our rural areas, how we deal with food as a economic and community issue. And then it's also got huge global ramifications. If we're doing organic farming, that's a completely different impact on the ecology and the environment than if we're doing maybe and today we have great examples of incredibly polluting production of food, methane gas production that's having an enormous impact on global warming. So there are personal ramifications of how this helps us flourish or not. There are community ramifications, and there certainly are global ramifications. So the same thing goes for the physical environment or for shelter. At a personal level, it may be the difference between whether we're happy and we're, joyful even, or whether we're depressed, because the physical environment affects our emotions and our feelings and our psychology. It also certainly has to do with our comfort, whether we're living a life that is pain-free or quite painful. It certainly impacts our personal relationships. Your home affects your relationship with your spouse, with your children, with your roommates, whoever you're sharing that with, by the arrangement of those rooms and by the lifestyle that physical environment promotes. So all of these things contribute to an impact of the physical environment on your personal well-being. Likewise, at a community level, our patterns of interactions with our neighbors, our neighborliness, our sense of community, our sense of being plugged into a community of people, all can be radically affected by whether or not we actually see people informally or whether we're isolated, whether we spend all of our time commuting in a little bubble vehicle, or whether we walk to work and see our neighbors walking down the street. All of this is a physical environment that creates a crucible for a sense of community or a lack of community. And likewise, the physical environment has global implications too. Certainly the energy usage in our buildings, which is about half of all energy consumed, our urban patterns, our transportation systems, all of these things have big impacts on global warming, on environmental degradation. There certainly are global implications of flourishing in the physical environment as well. So that's kind of the topic, this big, broad topic. We're going to focus in by looking at two case studies. And the first case study is looking at making a physical environment for Dell Medical School. And how could we use the physical environment as a tool for helping to nourish and to assist that faculty and those students in the educational enterprise they're a part of. And then the second case study we're going to look at is looking at Zack's enterprise with Good Apple and to see how that impacts, how that has a potential to fundamentally shape how we look at food and as a means of flourishing as an individual, but also as a community and as a whole culture. So we're going to start that discussion with Sue. And Sue is going to talk to us a bit about goals for Dell Medical School, aspirations. And then she's going to hand off to me, and I'm going to talk a little bit about how we tried to match those aspirations with the tool of architecture to accomplish them. And then Zack's going to chime in and say, well, as a student, this is how I experienced that. And we'll run through Dell Medical School as an example. Then we'll move on to our example with Good Apple. So kick it off, Sue.
Thanks, Larry. So I think I'd like to start with a little bit about how we designed our curriculum, because we designed our curriculum to be a new model of medical education. And we also designed our curriculum to think about human flourishing, and especially flourishing of our medical students. So when I was asked in 2011 to be the planning dean at Dell Med, there was a real need to rethink and redesign medical education. Medical education hadn't changed in over 100 years. It was based on Flexner's report from 1910 of 2 years of basic science, 2 years of clinical, and a more rigorous admission process. And yet the fundamental goals of medical education is really the transformative process of professional identity for our students to become physicians. And then second, to ensure that the students had the knowledge they needed to pass licensure exams so they could become practicing physicians. And for the most part, that meant memorizing a lot of information. Yuck. Lots of memorization. Yuck, yuck, yuck. And then Molly Cook and Dave Irby and colleagues wrote a paper that was published right before the start of Dell Med's development on revisiting Flexner. It was American Medical Education 100 years after the Flexner report, and how to prepare physicians for the 21st century. They said would require radical transformation in the acquisition of the skills for practice, including simulation training for training, teaching, and practice, instruction in professionalism, combined with the effective role modeling and attention to the hidden curriculum, i.e., where our students don't flourish in the hidden curriculum in the practice environment, and that more emphasis should be placed on the social, economic, and political aspects. Also at this time, Susan Shoselak and the AMA had a vision for a new medical school and a new approach to medical education. They were kind enough to come to Austin, the UT system, and visit with us prior to the launch of Dell Med and the recruitment of our dean to talk about what their vision was for a new medical school. So based on that, we decided to create the medical school to train physicians in health science delivery, address healthcare finances, support flexible pathways for physician training, to prepare the physicians to be leaders of the healthcare team and to know when to follow when they're on the team, and to provide leadership for ongoing improvements in the delivery of healthcare. So our goal was really to create and revolutionize the way people stay healthy by advancing that through our curriculum. And so we did several things, and I'm going to just briefly list those. We shortened the preclinical phase. I remember when our dean interviewed, he said, "You're really going to cram 2 years into one?" And I said, "We're not cramming 2 years into one. We've removed redundancy from the curriculum." And we did this all the time in reduced contact hours in the first phase of our curriculum. Keeping in mind we had to meet the accreditation criteria for exposure in behavioral health, communication skills, diversity, cultural awareness, evidence-based medicine, ethics, palliative care, geriatrics, domestic violence, everything had to be in the curriculum. So you couldn't remove all that. We designed an integrated curriculum with interdisciplinary teaching. We incorporated health system science and value-based care in our longitudinal leadership course in the second year when our students were in their clinical experiences, where it meant something to them. We focused more on prevention and public health than disease. We designed a 4-year longitudinal course to create a solid foundation in leadership, and we exposed our learners to effective leadership approaches, skills, and application exercises. And then one of the things I think we're most proud of is our 4-year interprofessional education collaboration and learning with nursing, pharmacy, social work, and medicine. Dr. John Luke is the co-director of that course. We also incorporated team-based learning and case-based learning into the curriculum, which is more active learning and more engagement. And we designed a building to facilitate all this, as you'll hear about. But I think our real key differentiator was to have some individualization and some flexibility of choice. And so our 3rd year of curriculum is the innovation leadership and discovery year. And the students can decide to do a independent distinction and discovery and inquiry project and have a presentation, or get a dual degree. They can go to 4 years of medical school and graduate with dual degrees. Interestingly enough, the dual degree I thought would be the least popular because it seemed to be like going to be the most hardest, was the Master's of Business Administration. And in our first class of graduates, 16 out of 50 got an MBA and their MD in 4 years. That's pretty impressive. And then we had the opportunity to address the hidden curriculum. So we had the ideal opportunity to create the best curriculum, to create what Susan Shoselak and the AMA's vision was, but we also had to live on the promise we made to the community. Because many people don't know this, but in 2012, the citizens of Austin, Texas, Larry and I are they, voted to raise our property taxes and to help fund the medical school. And so what did the community expect? They expected the medical school to deliver on what UT Austin promises, is that what starts here changes the world. So they expected our medical school to change the world. Moving on to how do we address the hidden curriculum and what did we do at Del Med? And a lot of our building design comes around some of these things, but we increased the time for self-directed study, relaxation, and reflection. In that our first year, which is our preclinical year, our students spend no more than 20 hours in lectures or in the small group learning activities. We also divided the class of 50 into societies, and this becomes important in our building design. We have a Tower Society and a Capital Society, and this is where our students can engage in social activities. They're with a smaller cadre of the class that they get to know them very well. There was a lot of competition, and it was not unusual on Friday afternoons for the students to go out to Zilker Park and throw frisbees and have contests and all supporting well-being of the student. We also developed a longitudinal program that focused on personal development of the physicians in training. This is called DOCS, Developing Outstanding Clinical Skills. And unlike most medical schools, the DOCS course was not only just in the first year teaching the physical exam and the history, it's through all 4 years where the students learn about advanced communication, medical humanities, ethics, law, and social determinants of health, what Larry and Zack have talked about. We also created a student wellness committee. The low-hanging fruit was to decide to go to pass-fail from the get-go, where the students work more collaboratively than competitively. And then finally, we incorporated some practices that are known in the literature to support well-being, and that's guided self-reflection and creative inquiry. All of this, planning this, and how we were going to deliver it came into play when we were designing the medical school. And our goal really was to create a different kind of physician, one that was not happy with the status quo in the health system, one that would challenge transformation in the health system, and one that would deliver high quality care to the patients that they're taking care of and make a difference in our community.
Cool. That's perfect, Sue. So let me tell you how we tried to take Sue's vision and the vision of her colleagues and to make a building that would be a tool for that vision flourishing and both the faculty and the students accomplishing those kinds of goals with the tool of the building. So as you could hear chock-a-block full in her description, this was a very student-centered kind of enterprise. It was all about human development, personal development of these doctors. So it's a 5-story building. And in the middle, the 3rd floor, that's the student floor. And the students own that floor. That's where they have their societies. That's where they have their study spaces. They own that floor. So if you're going anywhere through the building, you're running into the students who are on that floor. So it was very much student-centered. And the societies were very much built into the architecture of the building. There are little rooms that are kind of owned by small groups of 5 students. And then 5 of those rooms gather together to become a society. And so those 25 or so students, they have a lounge and they have a kitchen and they have a place to hang out. And then they have their little, and not so little, I mean, you could get easily 20 people into these smaller rooms that they occupy in groups of 5. So that whole floor really is owned by them and possessed by them. It's like if a faculty member wants to have a seminar in there, they ask the students if could we use your seminar room here, because it's really it belongs to the students. And that was really also about this notion of collaboration. That it was always teams of people. You weren't an individual. You weren't learning all by yourself with a gooseneck lamp and studying for that exam, as much as you were collectively learning things together and then working together. The idea was to have doctors that relied on each other and collaborated and worked as teams very well. And the physical environment supported that notion of always working in groups and teams. Even in the lecture hall, we have this wonderful, interesting design where you can all be facing the lecturer, but then you can flip your chair around on swivel chairs and be around a table with 8 people there. And you can have a conversation and then you can flip back around and talk in the larger group. But it enables you to be a little collaborative team in the midst of a larger lecture hall of students. So it was very much student-centered. As Sue also said, there was this very strong emphasis on interprofessional education. We took part of the budget and spent it in the nursing school to put all of the sim labs in the nursing school so that the medical school students, when they need to do that, they go over to the nursing school and they're intermingling with the nursing students. And then likewise, the nursing students, they come over periodically for interprofessional education in one of the rooms in Dell Medical School. So from day one, it's not the doctors learning over here and the nurses learning over here, but physically we're mixing them by the design of the physical environment that we're using. And always in team-based learning groups. The other thing is then to really make not just the students feel like a community, but to really make the entire Dell Medical School staff and faculty and students feel like a community. And we organized the building around this huge 5-story cascading stair that links all the floors together. There are punctures between the floors. So that's what we call the social edge. But about 1/3 of the building is just informal study spaces, hangout spaces, interaction spaces, circulation spaces. If you're going to the bathroom, if you're going to a lecture, if you're going for lunch, you're going to always walk through the social edge. And you're going to encounter your fellow faculty members, your fellow students, and there's informal encounter. And it's just human nature. Of course, you're going to say hello. After a while, you're going to get to know each other. And then maybe, well, would you like to join us for lunch? Or you begin to have these friendship formations that occur. And because all the faculty were coming from everywhere and they weren't a cohesive faculty to begin with, this was a mechanism for getting people to feel like they're a part of a community, that I know my colleagues. I run into them all the time in this social edge. And the library, the student lounge, even the society rooms, they all, the dean's conference room, all of those interact with that social edge and open onto it and become a kind of extension of this community of Dell Medical School. And I'm just blown away. I can never go over to that building now that I don't run into somebody I know and stand on that stair and have a chat. And I'm seeing everybody else doing that up and down that stair as well. The dean told me one time, I don't ever have to make an effort to go talk to faculty members or students. I just run into him. It's just natural. He's a very fit guy and he walks up and down those stairs all the time. And it's just an easy way for him to connect to that community. Another thing we did in the building along that social edge was something Sue talked about was this is a community building. This is being paid for by the taxpayers of Travis County. And so even the art in there reiterates that. There's a wonderful art piece on the lower level there where the artist came into Austin and she just took photographs of ordinary people, hundreds of photographs of ordinary people in a very sort of gauzy, filmy, artistic way. So you have little kids and you have, blue collar workers and white collar workers. You have the mayor, you have every kind of person in the city. And there's this beautiful mural that just depicts those are the people we're serving. This is our community. This is who we are. We're serving ordinary people and they're supporting us in our education. We also were very focused on, as Sue was talking about, not this stressful environment, not busy work, not, things that are just going to make you crazy as a medical student. But it still is, it's a stressful experience. So on absolutely every level of the building, there are outdoor terraces. And there are places to just go out there and do your email for a few minutes, but in the fresh air. And we're fortunate, we had beautiful big trees on the north side of the building. And so we oriented all that social edge to these big green trees, and there's kind of a park at the bottom. And you can just get out of whatever you're doing and be in the natural environment 10 steps from where you work. And that's true for faculty. And so you see these little clusters of people out in table and chairs on those terraces in a much more relaxed kind of environment than if that were in a kind of conference room or something like that. So natural light was another huge, just psychological thing in the building. Sue likes to talk about the fact that we don't have to turn on our electrical lights because every place in that building has enough natural light by itself. And it is just a cheerful, bright, upbeat kind of environment. And then all along that social edge, beautiful views into nature and trees, and you feel like you're in a garden. And then you also get kind of expansive views back to the campus. And that big cascading stair it's an exercise machine, is what it is. I mean, there's an elevator, of course, and some people take the elevator, but most people walk up and down that stair, and it just gives you a bit of natural exercise. So in all the ways Sue was talking about, we were trying to produce an environment that would support and help the students flourish in this different environment for how you would educate doctors. So I'm going to hand it over to Zack and tell us how it was to go to school there.
Yeah. No, I think, one of the big challenges in medical education, as Sue was mentioning, is there is so much to learn, and there are certain requirements to make sure that you can pass your board exam. And so how do we also fit in these other important aspects of human flourishing and leadership and community building? And I think, as Sue and Larry have mentioned, a lot of it was built into the curriculum. And I think it really first starts on what they were saying and taking a human-centered design approach to building the curriculum. How, for such a diverse class, do you build out an experience that feels like everyone's putting on their own individual glove? And I think that's really challenging. But the way that I think I felt it most as a Del Med student was that idea of an individualized experience with getting some of my time back, where we have very high quality in-person lectures, but we're only in class for about 20 hours a week. You get to flex some of that time that maybe historically you'd be in class to then working with your peers, or being able to individualize your learning to specific learning styles that you find most valuable. And so I think that was one thing, especially in the preclinical year, that was very important, was kind of allowing putting students in the place to direct their own learning, which I think can be scary because there is a lot of information for them to learn, but also giving them that space to flourish on their own. I think I always felt very well supported by everyone at Delmet, and I knew that if I ran into an issue that I could reach out to a professor and talk through an issue, but at the same time, they were giving me that trust, that I could go out and learn this very complex material as well. So I think during the first year, that was a huge part of it. And then I think looking also outside the beautiful glass windows that we have at the med school, and thinking, how do we get students excited about getting involved in the community? And I think that was a very thoughtful piece of the curriculum early on. Day one, we were talking about how food influences health before we'd even talked about all of the important biochemical equations that you need to know as a physician. And I think that was a tone that was set very early. And then it wasn't that, thinking about the environmental spaces or thinking about how food impacts health was an add-on or an extra, but actually, front and center to how we can lead as physicians in a community health space. And so I thought that was really important. And, as Dr. Cox mentioned, going into the third year, and getting to choose kind of your own project for an entire year, to focus either on getting a dual degree and building a specialization in business or arts, or going out and doing a community project like I did with Good Apple. I think that opportunity for individualized learning really allowed me to flourish as a med student.
Excellent. So now let's morph into this discussion of food as maybe another one of those everyday life kinds of factors, and how that's a tool for flourishing. So maybe Zack, you could continue here and tell us a little more about what Good Apple does, and how you extended that flourishing.
Absolutely. I think, again, going back to the curriculum and the flexibility that I had as a even first and second year student before I focused on my big third year project, I had extra time to kind of go outside of the med school, and actually took a class over at the LBJ School of Public Policy. When I took that idea first to our Dean of Medical Education, they said, absolutely, go do it. And that was in the midst of some pretty intense preclinical work. So I think just that opportunity to go out and take this course with other students from the law school, the social work school, was an amazing experience. And we actually focused in on working with what is now the Baylor Collaboration on Hunger and Poverty. So that's really where I first learned a lot about food insecurity, specifically in Austin. I think as someone who works every day with patients now, it's a big part of chronic disease management is having access to healthy food. Unfortunately, in Austin, there's still about 1 in 4 people who don't know where their next meal is coming from. And that amidst some of the amazing tech innovation that we have in Austin, I think that was a problem that I got really passionate about. And so then going into my second year of the clinical work, being in the hospital, being in the clinics, seeing patients that are coming in with, diabetes, sequela, or chronic congestive heart failure, and knowing that a healthy diet is really one of the most important things to addressing these health issues long term. Talking with patients and understanding that they felt like they didn't have access to healthy food, just reinforced what an issue it was. And so that's really how I got to Good Apple and trying to get people healthy access to food. And I think, one thing I'd love everyone to take away from my experience as Good Apple is, I think anytime you are trying to tackle a problem, you always want to go to the people who are experiencing that problem firsthand. I think that it'd be very easy to look at food insecurity in Austin and say, maybe the issue is that we don't actually have enough food in Austin. Maybe we need to build more farms. We need to get more grocery stores. And to some extent, that's true. But actually, when we talked with people, Larry, what we found was that it was the physical spaces that were really keeping them from getting food. Austin is a really unique city in the sense that it has the most food banks of any city in Texas. And so there's actually plenty of food in Austin. The problem is that people just can't access it, whether that's because they don't have their own form of personal transportation, or the bus systems are not quite as good as other big metropolitan cities. So actually just getting to places where there is free food is a huge barrier. And so that's really what we tried to focus on with Good Apple, was not only this idea of providing people with healthy food, but providing people with healthy food that got to their doors. And so that's the project that I was able to work on during my third year at Del Med. We started off delivering, 50 boxes a week, which I thought was already a huge success. We were giving boxes to both paying customers and then using those funds and partnerships to fund delivery of food to people facing food insecurity. And then that was in November of 2019, just before, this global pandemic hit. And so then immediately that next spring, all of a sudden there was a need for delivered food to people facing food insecurity. And we saw a lot more people facing food insecurity because of the pandemic. And so we had built this, small expertise around how do you get food directly to people's doors. And that was an insight that we had prior to the pandemic. But I think what really enabled it to flourish was the community partnerships that we were able to build. So the dean called me up and said, "Hey, this is a really important issue. Is there any way we can expand the work you're doing?" And we reached out to a number of community agencies in Austin, including the Austin Transportation Department, who was seeing a downtick in their metro service because people weren't using the bus during COVID. And they said, "Hey, we have extra buses around. Could we help you guys deliver food?" We also teamed up with Bank of America to get some incredible community philanthropy. And so that really enabled this insight to turn into a huge system where to date we've delivered over 30,000 deliveries to people facing food insecurity, amounting to over 500,000 meals. So it was just an incredible thing to see this idea of the building and the curriculum enabling me as a student to have the time to think about this problem, having the space during the third year to go out and actually develop a solution, and then looking out to the community to team together and really make it successful in what it is today.
Excellent. Great description, Zach. So Sue, you got something you want to add on Zach's effort there? You watched it all blossom.
I did. Zach is a rock star. I mean, really, he did exactly what we wanted to see happen in that third year, and that he took to, he created this company and delivered and actually helped us to show the community that we can create future leaders, and we can create leaders who are going to transform the health in the community. And it's no small feat, but he did it. So.
We're about at our stopping point, but I just wanted to wrap up and just sometimes it's in the back of our head maybe, but we're unconscious of how much the environment we're working in, and that is physical environment and social environment, psychological environment, either gives us the sense of we're empowered and we can take initiative and we can do things, or it's a system that tells us you're a part of a structure here and you better just stay in your line and stay in your place and everything will be okay. Or even it communicates to us that you're disparaged, you're hopeless, you can't self-actualize. And I think it is a complete environment of physical and social and attitudinal and psychological that makes you flourish and makes you able to see yourself as empowered and able to realize your goals and truly flourish. So with that, I'm going to send it back to Kimara, and she'll take us from there.
Great. Thank you so much, Larry and Sue and Zach. On behalf of the KNN board and team, I want to just extend a sincere thank you to you and to everyone here. We'd like to take a moment to hear from you and give you an opportunity to respond to what you've heard today. Great engagement in the chat. Please do feel free to continue to send some questions in. And we'd like to invite you to consider at this point how you might be able to apply what you've learned today. I noticed that there were some questions in the chat, right? Not everyone is launching a new medical school, right? So not everyone has the opportunity to build a new building or to create a curriculum from scratch. But that doesn't mean that there aren't elements in what we heard today that we couldn't take away or think about how we might translate that to our own environment. So I'd like for you to just take a moment to consider what is one thing that you think you might be able to do to encourage flourishing within your community. And we'll let you define community in the way that it's really hit you this afternoon as you've heard about this. And so would you share that with us in the chat, and we will look forward to gathering those responses.
While we're waiting, I'll share a story that when we were designing the med school, we had thought about going to mainly virtual anatomy, which a lot of schools have moved to. And Larry hosted a dinner for 6 pre-meds and 6 medical students that were rotating in Austin, and said, what do y'all think about this? You know, here's what we're just thinking about. And 12 students in unison said, we would not come to Del Med if there's not anatomy lab and cadavers. It's the rite of passage to be a doctor. And so we went back to the drawing board and created a different anatomy experience in our curriculum.
Thank you, Sue. I think that's a powerful example of the point that Zack made when he was talking about some of the decisions that he made around Good Apple, about the power of going to the community, right? Going to the people, the human-centered design approach to what we do, and the power in that. So here's some of the things that I'm hearing in the chat. This is new verbiage apparently. More opportunities to volunteer. I like this one. It doesn't take any more time to be kind to someone than it does to be rude. I don't know why that seems to be getting more difficult as the pandemic and the challenges go on, but that's a powerful reminder of the flourishing that we can bring in our interpersonal communities that we're creating more flexibility in how to show up at work. That's powerful. You heard a lot of that in the story that Sue and Larry and Zack talked about in terms of how the students could show up, where the faculty were, just that opportunity for that flexibility. And if you will, a little bit of that integration of personal and professional and the ability to be able to express that. Concentrate on interprofessional education, utilizing the other schools on campus. I love that. I love that idea. Figure out how to create high value lectures that students want to attend. Perhaps, Zack, you could start a consulting business on the side as well, and give some insight on that. An academic nursing leader who's trying to figure out what to do with a big building that's being renovated. Share some ideas there. That's really powerful. Get to know to learn your community first. Consider organizing vaccine clinics at schools or in other settings for those that can't easily access hospitals. I love that. Or for which a hospital is a really intimidating or scary place to go, right? Making it more accessible, more approachable. Aim to bring out the best in each member of the community. This is fabulous. Changing my own personal physical space. That is so powerful. I am looking around at some of the mess on my own desk and wondering how that's helping me flourish. And whether it is the offices that we get to be a part of and influence, all of us have changed in many ways, the personal spaces and what that looks like in terms of how we're doing work and how can this contribute to that. So there are more just incredible ideas that are flowing in. We thank that. Keep those coming. We're excited to collate those and be able to share those out and keep those for all of us to just continue to keep in mind. So again, we want to just extend a sincere thank you to all of you for participating today, for being willing to enter into a more unique conversation about flourishing and the intersection of physical space and community with the healthcare ecosystem. And so we're grateful again to our exceptional panelists and partners, as well as the generosity of the Kern Family Foundation, who makes the Canon's work possible. Looking ahead to April 26th, which is the next time we will gather, so please do mark that date on your calendar. We will be focusing on flourishing in the organizational setting. We're going to have leaders from Mayo and Ascension Health join us to discuss their unique organizational cultures, how they developed, and the ways that they contribute to learners, practitioners, and patients thriving. Now, for those of you who asked some questions that you have not yet gotten answered, or you have additional questions for Sue, Zack, or Larry, our speakers will be available for the next 10 minutes to do some additional Q&A with you if you would like to stay on the line. So those of you that may have a question or just would be interested in continuing the dialogue a little bit further, we do encourage you to stay. Otherwise, thank you again for attending today's session. We're so grateful, and we hope that we will see you again in April as we continue to conquer Flourishing 2030. Thank you all.